I am excitedly here with Dr. Gil Blander, who's the Chief Scientific Officer and founder of InsideTracker, which I know a lot of my listeners may already be using. And if not, I'm so excited to introduce you to Dr. Blander and talk today about his amazing, life's work and his amazing company that he's built. So I'm so happy to have you here today.
Thank you, Michelle. It's my pleasure.
Wonderful. So really just to kick us off, can you let us know more about what really got you interested in longevity, in biomarkers, and in this aspect of the wellness space? What was it for you?
Yeah, from a very young age, I was fascinated by the aging process. I lost a relative of mine at the age of 12. And instead of being sad about her, I was sad about myself. And I realized that I won't live forever. So I wanted to find and understand, why do we die? How can we delay the onset of aging-related diseases? How can we improve the quality of life and so on? That's why I decided to study biology and then pursue a PhD in biology at the Weizmann Institute of Science in Israel. After that, I moved to MIT and worked at the best lab that studied aging in the world, and spent 5 years there studying some of the genes that have been shown to increase lifespan in model organism. And during that time, I started to be exposed to the biotech, high-tech environment of Kendall Square, which is the area around MIT, and realized that maybe I can contribute more to humanity if I start my own company than being a professor in academia. So I left MIT, worked in a couple of companies, and came with the idea of InsideTracker. And the idea is pretty simple. Let's help humans live better, longer life based on what's happening inside the body, and then provide to them a simple and natural intervention, including food, supplement, exercise, and lifestyle changes.
That's incredible. What I love about your story, too, is that you had this idea as a child from an experience that you had, and you turned it into this lifelong mission where I feel like are going to be impacting and already have, of course, impacted since 2009. You've had InsideTracker, so many people's lives. So we just need so many more, Dr. Gil Blanders for that reason. So that's really incredible. And tell me also, when you specifically speak of longevity, is your focus years on Earth? Is your focus health span? Is it a combination of both? Tell me about that.
I think that it's a combination of both, but I think that the big opportunity is the health span and not the lifespan. So I can give you an example. Today, average American live around 79 years. But actually, the last 16 years are not in a good health. So basically, some of us, or some of the American, lie on a bed connected to tubes, and that's not exciting. So our mission is to narrow the gap between the 79, let's say, to the 63, and take these 16 years and allow us to climb a mountain, to ride our bike, to spend time with our grandchilds, and have fun. And that's the vision.
Especially because that's usually the time that people spend, the only time in their lives not working, right? That's the only time that they're spending actually being able to enjoy their lives. So it's this very backwards idea that we have of working when we can and then not enjoying our lives, the rest of it, for sure. Are you still as hopeful and excited about the research you're seeing as when you started?
I'm more excited, actually, and more hopeful. I think that if you want, we can discuss it later, but there are a lot of new discoveries, both on health span and lifespan, and there is a lot of exciting work about all of that. There is even an X Prize that announced a few months ago that they are going to dedicate $101 million for a company that will be able to extend the perceived life of a couple of organs in the body by 10 or 20 years. So that's amazing that who thought about it, 10 years ago. It is amazing.
Yeah, it is. Especially, again, this space that you've been focused on for a long time. Like you said, it's really exploding. And there's a lot of people who are now realizing, oh my gosh, if there's anything I can do, I want to do everything I possibly can. In historical research, when, people have kind of preferences for longevity and health span, like some people are saying, oh, the China study leads us to believe certain things. Blue zones believe us to kind of lead our understanding of diet in a certain way. Is there something that you right off the bat feel more inclined to be supportive of diet-wise? I know there's a lot of tenets of diet, but anything that in your research, you found?
Yeah. So definitely you are an expert in diet. I will tell you my opinion and my viewpoint, and I'm not claiming to be an expert in diet, but
I want to know your viewpoint.
Yeah. But I spent the last 15 years or so learning a lot. So I think that it's very tough to come and provide a cookie cutter diet for everyone and say, the paleo diet is good for everyone, or a low-fat diet or low-sugar diet, and so on. I think that the right way is to personalize it for the user or for the person based on what's happening inside our body. Our body is really unique, and it's in a way, it's a very complex machine. So it's not like, it's the same, think about a car. You cannot come and say, I pump the same gasoline to all the cars. Some cars are built for that gasoline, or take an electric car and feed it with gasoline. It won't work. So it's the same for us. We need to feed the right diet for the right person. And in my opinion, the right way to do it is personalization. So that's why we are looking at a lot of blood biomarkers. And based on that, assigning to the user a few key recommendations, what food he should eat more or less, what exercise he should do more or less, and so on and so forth.
Absolutely. So I'm biased because I was looking for a specific answer and you gave the specific answer. It was a leading question and you really passed it. So yes, I really, of course, agree with you that I have clients who do well on a higher carb diet and clients who do well on a higher fat diet. It really is every single thing we eat creates such a cascade in the body, and not one food in isolation causes or creates disease on its own. It's really the combination of the environment plus the food. So your focus really at InsideTracker, which we're of course going to talk much about in this conversation, is on how we can leverage biomarkers to make those recommendations. So how did you start to make the determination that blood biomarkers was a way that you were going to really push the field of longevity forward? How did it become so important to you?
Yeah, it's a good question, and because my fascination in longevity, I was trying to find how can we mimic something called caloric restriction that I'm sure that you know. I'm not sure that your audience know, but caloric restriction is a regime that was found in model organism to extend significantly the lifespan. So, for example, in mice, if you cut the amount of calories by 40%, the mice can live 40% longer. And I was trying to find how can we use a caloric restriction mimetic, meaning let's fool our body and let him believe that we are under caloric restriction, take a pill, like a silver bullet, and then we live longer, better without the suffer of caloric restriction, because that's very hard. It's like... it's very tough to do it. You are very cold. You also lose the sex drive. You lose
your hormones start tanking. Your drive to want to live that long might go down as well during that time. Yeah,
you might want to die, just not to
exactly.
So I was trying to understand what is the mechanism of caloric restriction, what's happening under the hood. And I was fortunate enough to use a very good technology in the company that I worked at. At that time, it's called system biology. Today, it's computational biology, or maybe AI, NML, and all the keywords buzzword that we are hearing today all the time. Of course. And I crunched a lot of data into that, and basically realized that there are a lot of processes that happen under caloric restriction. I was under something, maybe it's one process. But in biology, as always, everything is much more complex than we envision. So there were like 15 different processes that change in caloric restriction when you compare it to non-caloric restricted mice. But also I use a control, and at that time, resveratrol was considered to be the best caloric restriction mimetic. So I tried to see how similar it is to resveratrol, and only 10% were similar. The rest were completely different. Yeah. So then I said, even the best caloric restriction mimetic is covering 10% of caloric restriction. If you're thinking about more and more drug, we might need 20 or 50 drugs to do that. And I said, why should we do that? Why can't we use food as a drug of choice? And basically feed the right food for the right person and allow him or her to live better longer. So then I said, okay, but how would we know what Michelle should eat versus what Gil should eat, we cannot look at you and say, Michelle, you should eat more carb and less protein.
Exactly.
So as a scientist, I said, okay, blood biomarkers is what we should go, because if you think about it, it's a liquid gold. It's something that our clinician using in order to decide how to treat you. So I said, let's use it also for other things. Instead of only for treatment, let's use it for prevention. And let's understand what are the issues that you have with your blood biomarkers. And based on that, let's try to find a food as a drug of choice. We have 6,000, 8,000, depend who you ask, of food items. And if you look at the average American in the average week, we only consume around 45 food items. Wow. So you have a universe like that, and we are maybe using that. And even that, I'm not sure that it's good for you. You eat it because
it could be 100% of most products.
Yeah,
exactly.
So that was the aha moment, I think, for InsideTracker. Let's find biomarkers based on that, feed the best food for you, and hopefully allow you to live better longer.
Yeah, that's really incredible. And I do like the concrete nature of labs, even though they are always a snapshot and they do move. I like the truth in labs. And I've always found that very comforting when I'm working with clients too, to see that. How did you start to kind of piece together, these labs might be indicative of this? How did that picture come together for you? Was that in actually doing research with people or just reading research and evaluating?
Yeah, it's a good question. And it's actually a process that took us a few years. And it's not only me. We have at that time, we had a small team. Now we have a much bigger team that helped doing it. But what we have done, I went to Quest Diagnostic website and have seen that they have like, 1,000, 4,000, 5,000 blood biomarkers. And I realized you cannot test all of them because you might not have enough blood in your veins, but also the cost will be enormous. So we came with a few criteria to pinpoint what blood biomarker we want to test. So first is biomarker of health and not a disease. So I'm not looking at biomarker for cancer, but glucose is an interesting marker. Inflammation is an interesting marker. Some hormones, some vitamin and minerals. So we started with that. The second rule was that those biomarkers should, at least 1% of the population should have those biomarkers out of the normal range. And the reason for that is I don't want to waste your money. And if something is less than 1%, it is important, but it's less important than something that is above 1%. And then, and I think that the most important rule was, let's use a blood biomarker that you can modulate by food, supplement, exercise, and lifestyle changes. So I don't want to use drug. I want you to use a natural intervention that will allow you to optimize it. And that was the criteria to select the blood biomarkers that we are using.
I think for many people, there's a couple barriers to getting blood work done, which is what I really do appreciate about InsideTracker. Is one of the biggest barriers is that medical doctors will not run labs that they are not qualified or understanding of how to interpret. So many doctors don't run vitamin and mineral labs because they don't feel that they can interpret them. And actually, in certain states, doctors are not allowed to run labs that they cannot themselves interpret. So it's just a place for clients and individuals to become their own health advocate. So I think that's just so important and something that I think is really missing for people. The other thing is that, which I know we're going to talk about, is that there's a difference between looking at labs kind of from this conventional range versus this functional range. Can you walk us through that a little bit as well?
Yeah, absolutely. So if you think about the lab range and what is normal and out of normal, it's pretty simple and very cold way to do that. The lab is looking at 10,000 or so a patient that came in the lab. And then they're looking at two standard deviation and saying, okay, above and below the mean. And that's saying that's too high and that's too low. So it's basically a statistical analysis. Now, more than that, in a lot of them, they are also including sick people. So basically, the normal range might be, and if you think about it, most people that come into the lab are sick people. So the normal range might be calculated based on sick people. So we when we've seen it, we said that's wrong. Let's find something better. So we developed something that we call optimal zone. And the optimal zone is a zone that we believe, not we believe, the science literature believe, and a big database allow us to come to that's, if you will be there, you have a better chance to be better today, tomorrow, in 30 years. So basically live better longer. And we calculated those based on a peer-reviewed scientific papers that show what is the best zone for someone for glucose, or for what is the best zone for someone for testosterone. And that's based on your age, gender, ethnicity, athletic activity, and so on. So basically, on top of the normal zone that are pretty wide, we develop an optimal zone that are narrower. And if you will be there, you have a better chance to see the doctor later. That's the idea.
Absolutely. And most people, again, don't want to be average of the sick people. They want to be optimal of the optimal people, for sure. I mean, we described that about, close to 60% of this like the American population, at least, is suffering from some sort of chronic illness. And again, if we're looking at the average of that, it's really the average of the unwell, unfortunately. So I do have a lot of clients who, when they also get their lab tests back, they feel extremely overwhelmed and really nervous when something appears abnormal. Can we talk about how important it is to see labs in context of other labs and in context of symptoms as well?
Yeah, so you're talking about the freak out problem, I would call it. Yeah, so people are, and some people, and I think that it's a matter of personality. If you see something bad, you immediately lost all of your conscience and trying to deny it. And basically, say, why have I done it? I have so many problems in my life. Now I need to deal with that. But actually, it's good to know, and especially if you are out of the optimal zone and not in the normal zone, you have a way to fight it. So it's not like, okay, my, let's say, LDL cholesterol is high. That's it, I'm doomed, I'm going to die from cardiovascular disease in 5 years. Yeah, if you won't do a lot about it, you might, but if you do take some steps, you have a very good chance, I would say more than 90% chance not to have the cardiovascular disease. Change your nutrition, change your exercise, change your lifestyle, maybe stop smoking if you're a smoker, or lose some weight if you are overweight, and you should be okay. So I think that what is nice about it, that there is a lot for us to do. Unfortunately, our clinicians are too busy to tell us what to do. So if you come to your clinician Absolutely. And your LDL is high, the easiest way for them to say, okay, take statin. Now, I'm not against statin at all. You can take statin, but try before that to lose weight, to exercise, to eat more fiber, and a lot of other things. And if it won't work, then go and take statin. That's absolutely okay. So I think that we are providing, if you think about it, in the prism of from being very healthy to very sick, we are providing, we are trying to push our user to the left as much as possible, to be as healthy as possible, as long as possible. And I'm not against any drug. If you need to take drug, take drug. It is important.
Absolutely.
But there is a lot to do with nutrition and lifestyle and exercise, and people should know that.
100%. Yeah. There's also, I think the vision we have of functional medicine is that it's anti-allopathic medicine, and that's absolutely untrue. Functional medicine means we leverage every tool we possibly have. So in some cases, that could mean a drug intervention, in some cases, a food intervention. And really, it's the cumulative nature of those interventions that is what I think is at the heart of functional nutrition, is changing that environment of the body. Absolutely. And I love how you speak about that too. One major barrier that I see with my clients is their ability to get comprehensive and functional lab testing. I am so excited to introduce our podcast sponsor for today's episode, InsideTracker. InsideTracker is more than just a lab company. They help to personally select the exact labs you'll need to have a really comprehensive view of your health. And they will actually send someone to your house to get those labs completed. Once those labs are completed, they will go into your InsideTracker dashboard, where you will get insights into how these labs are important and what changes you can make based on those labs. The labs that are run are extremely helpful for those who are not able to get their doctors to run every lab that they need. I've been using InsideTracker with my clients and found amazing insights from their professionals. InsideTracker also integrates with apps like Apple Watch and Aura. It can also integrate with your DNA testing to give you more insights on that as well. Whether you want to improve metabolism, heart health, cognition, sleep, stress levels, InsideTracker helps to reveal the exact areas of your health that need improvement. One other barrier I found with clients outside of getting prescriptions for those lab tests is actually being able to understand and interpret. So that's why I find InsideTracker so incredible. The InsideTracker scientists have sifted through the research so that you don't have to. If you want to test, not guess, when it comes to your health, save 20% on all of InsideTracker's plans with my exclusive deal. Go to InsideTracker.com/quietthediet. That's InsideTracker.com/quietthediet for 20% off of any InsideTracker plan. You can find this link in the show notes. There's actually a lot of debate about whether LDL cholesterol is a marker for heart disease at all in the functional medicine community. So can you speak a little bit more into, I know I have to, I have the same grin and I've been asking you the question. I want to hear what you've done research wise on heart disease and cholesterol, and how LDL even as an independent marker for longevity. Just curious what your take is on that.
So there is a lot of data that show that those lipids, especially the LDL cholesterol, is a good marker for cardiovascular diseases. There are better markers. And for example, one of the most important, in my opinion, is ApoB.
ApoLipoB,
yeah. And unfortunately, I can tell you, I went to my clinician a few months ago, and by the way, I'm using One Medical. I don't know if you heard about it. So it's more like concierge, all of that. And I asked my clinician about ApoB. I showed her all. She said, we are not testing it. It's too expensive, and it's not covered, and so on.
It's kind of the gold standard right now, though, to understand how much of an issue the cholesterol you have is. So I think
absolutely, but somehow the medical physician or clinician are very conservative and very slow to move. And also think about it, they have 2,000, 5,000 patients that they need to see. So basically, they have a strip of 15 minutes that they can see, and then they're going to the next patient and the next patient. 100%. They don't have time to read literature. They don't have the luxury, Michelle, that you and I have. I can sit an hour and read the paper.
We love it. By the way, it is the joy of our lives to do so. Yes, absolutely.
It's really sad. They don't have time to do that. So they don't have time to get an update. And they have the guideline of their association that, again, it's, 10 or 20 years behind. So something like ApoB, that in my opinion, every person in the world should be tested with that.
As much as your H&H or these other markers that are for many people not as usable, it should be used even more. Exactly. It tells you even more. 100%.
So if I'm trying to summarize, there are a few very good blood biomarkers for your cardiovascular health, and I think that there are a lot of modifications that you can do that are lifestyle, that you can change it and try to catch it early. Because again, if you think about let's go back to the Western medicine for a second.
Sure.
The cutoff for LDL is 130. So even if you come to your clinician and your LDL will be 129, you'll say, what are you talking about? You're okay. Go home. But they are not even looking at the trend. So let's assume that you tested.
Patterns are most important.
And that's something exactly very important. Let's assume that at the age of 25, your LDL was 85. And then at the age of 30, it was 100. And at the age of 35 is 120. There is a trend. You're trending up. You should do something. They won't do anything. They say, you're okay. When you'll cut the threshold of 130, come and talk with me. And that's really wrong. Why? Because the atherosclerosis accumulates with time, and the plaque is growing and growing and growing. So if you are treating it early, you have a better chance not to have the cardiovascular disease. It's very hard to save you when you already have that. So that's why I'm saying the prevention and the aging process is not starting at the age of 65 when you're retiring. The aging process starts at the age of 18, when you stop developing and you're starting to decline. Unfortunately, I told it to my wife one time. She looked at the mirror and said, I have some issue in my skin. I said, take a picture. That's the best that you will look in your
Oh
life.
my God. You're in huge trouble for that one, I'm sure.
Yeah,
I think it's huge
I went
trouble.
to the doghouse.
Yeah, you're
but,
done after that. Exactly. Yeah.
but that's the truth. You can delay it, you can stop it, but it's very hard for us to go back. There are some people that claiming that we can go back, maybe, but with the technology of today, every day that you wake up in the morning, most likely it's the best day of your life for the future. So take
I
care
hate
of it
that
and
idea,
enjoy.
but I agree. But I hate it too. Exactly. I don't think we've all had the easiest ride, in the past. So if it's going to get harder, I'm not loving what you're saying, but I do agree with what you're saying.
No, but it can be better. For example, I can give you an example of myself. We don't only do blood biomarker testing, we also do DNA testing.
Oh, it's fantastic.
We develop something that we'll release in a couple of weeks, scores about health span related longevity scores, and one of them is grip strength. So the strength of your grip is a good indication of longevity. I did the test and I was in the bottom 2%, meaning my grip strength genetically is low. So, and I did it a year and a half ago. Now I'm lifting weight like 5 times a week.
Yes.
And I'm feeling the best that I've been. I'm stronger than I've been in all my life. Okay.
That's
but
incredible.
What is nice about it, it's personalized. I need to do that. Someone else might have another test that we are doing that we're looking is the chance for you to have a late life dementia. Okay. And if you have a high risk, you can start playing Sudoku and some. I don't need to do that. Luckily, it sounds like I don't have a genetic predisposition for that. Another person might have a visceral fat issue. Another person will have bone mineral density issue. So I think it's good for you to know the issues early, relatively, work on them, and hopefully you will be able to increase your health span as much as you can.
I think also when it comes to this model of conventional medicine, what we've kind of done is, and like you're saying, I do feel really bad for conventional medicine doctors, by the way, because I'm very aware that they came into this career to help people. And like you said, they don't have time. And in many cases, they don't have tools to help people with chronic conditions. The model of modern medicine is really to help with acute conditions. That's really what it's for. There's no tools for them to help people with it other than medication intervention. So I feel bad because I think they get a bad rap, but they literally have worked so hard to help other people, but just don't have those tools. So we need tools like this, and we need companies like yours who are willing to take more risks and not wait 20 years for the research and do the research yourselves to do that. So I think it's just really, really important too.
Yeah, just to add to that, Michelle, if it's possible.
Yeah.
If you think about a normal clinician, they spend maybe 20 hours in all of their training on nutrition. Think about it. I read one book on nutrition. I know more than a clinician.
Exactly.
And
you've read a lot more than that, but yes, exactly. Yeah.
And that's why dietitians like yourself are so important. And people are, and I think that actually when I started to work with dietitian, the reputation was, it's not important and all of that. And I think that it's not only longevity, it's also a diet and dietitian. I think that it's people understand that you have so much expertise there. In my opinion, the nutrition domain is the most complex because, as I said at the beginning, you have like 8,000 or maybe 80,000 building blocks. And then how are you building the building based on the building block? It's like a very tough task. And I think that people or experts like you with expertise in nutrition can help other people to find the right diet for them. And it's super important. The diet is very important, and we are not spending enough time in that.
There's a lot of dietitians in hospitals right now who are listening to you and just smiling because they're so dismissed in the clinical setting and really need to hear you saying that. So thank you very much for that. I will say in a not as excited, I'm very excited about the world of functional dietetics. Tell me for yourself, what are some others that you think are grossly underused that you have in InsideTracker that are really important?
Yeah, another good example is insulin. In a way, it's similar to ApoB. Because if you think about it, you look at the lipids, so usually you test for HDL, LDL, total cholesterol, and triglycerides, right? And then you have a jump that hidden that is ApoB. Here in, let's say, the sugar metabolism, as I call it, you have a fasting glucose or glucose, and then you have A1C. But actually, insulin is a very important early detection marker. And just for the audience that is not aware a lot about insulin, insulin is an hormone that is secreted from the pancreas when we eat or when glucose is released from the liver to the end organs. And its job is to signal to the end organs to absorb the glucose into the cells. What happens is if your glucose is very high all the time in the blood, your pancreas needs to secrete more and more insulin, and the beta cells which secrete insulin started to overwork. It's like you have a machine that works all the time, or your heating is working, or your air conditioner is working all the time. A few years later, they will stop. The air conditioner will stop working. The same is here, and high insulin in the blood is early signs for much earlier than when you see the A1C going up or when you see the fasting glucose going up. So I think that's another gem that we have that I don't know a lot of clinicians that are testing fasting.
They are not. And so I've had 2 experiences with Manhattan doctors who actually tested insulin not fasted, and the numbers was like 50, and they told the clients, you are diabetic because, and I said, but they weren't fasted. Both of these clients had eaten carbs directly before. You need to release insulin after you eat food. So this is a consideration for this lab, and anyone who's getting InsideTracker labs, they're fasted for the test anyway. But if your doctor's running an insulin and doctors are not comfortable in understanding the test, make sure it's fasted, because it's pretty much useless, in my opinion, if it's not fasted.
Yeah, it's outrageous that they're testing it. When
And told them they were both 2 different patients in the same practice. They said, I'm diagnosing you as diabetic. Their A1C was like a 4.9. And I'm like, that's not a criteria for diabetes. Like, it's really letting you know, like you said, what's that signaling system in your body around sugar?
Yeah. So that's another example. Another, I think, a cool example that it's more about the iron metabolism, and it's a marker called ferritin.
Let's talk about ferritin.
Yeah.
Good conversation.
And it's very important, first for athletic active people, but mainly for, I would say, for a female, because of the female are used to lose blood once a month. And a lot of them, we've seen, we have maybe 20% of our pre-menopausal women that their ferritin is low, and they are at risk of being anemic, and they don't know about it. And then they're going to say, when I'm running, I'm getting tired after half a mile, or why I'm tired all the time, and why I'm not performing at the board room. And all of that is simple. You just need to know. So ferritin is a marker, basically. It's a part of the process of loading the iron on the hemoglobin and allowing you to carry oxygen from your lung to the target organ, especially, I would say, to the muscle. But that's another thing that somehow our healthcare system decided not to test. Maybe it's too expensive, maybe it's too complex, I don't know. And it's something that is very important for every a person, especially premenopausal women. It's a big problem for this subpopulation.
And I'm going to throw a curveball about ferritin at you too. I use ferritin to kind of assess 2 things. One of them on the low end being iron deficiency anemia. On the high end, are you looking at iron overload as being a potential risk factor for inflammation as well?
Yeah, absolutely. So I don't want to go into the weeds, but what is nice about ferritin, no, it's okay. Ferritin low is meaning anemia, high is meaning most likely you have some issue with your inflammatory system. Yeah.
Which is also just so important about InsideTracker too, is that, again, you're not looking at things only from this model of, it's too low or it's too high. It's really, what is that in the bigger picture of things, and how do we interpret these labs to get as much juicy information as we can from them?
Yeah, and I think, Michelle, you raise a very good point here. Some people think, like, let's say, vitamin B12, okay? something saying the more the merrier. I will load myself with vitamin B12 and I will be good. No, there are some harm from having too much. So most of the marker, you have like a Goldilocks zone. That it's not easy because it's too much is not good and too little is not good, and you need to find and adjust it in a way that it will be in the Goldilocks zone, and then you have again a better chance to live better longer. It's not easy, but it is important to do that.
100%. And when we think about something like B12, then our brains are going, oh, are you not methylating it properly? Why is it so high in your blood? You know, what's going on? Or if it's something like vitamin D, then I'm instantly thinking, oh my gosh, are you getting enough vitamin K and A then if your vitamin D is so high? Like there's vitamins kind of like compete with each other in our body. Yeah. So those balance levels, like you're saying, are so important too. So I think looking at apolipo-B and ferritin, to us seems like, again, for even 10 years, you're like, this is a no-brainer. Of course, we have to test this, but this could be life-saving, life-changing information for people whose doctors are not running this. And let's just be totally honest, most people's doctors are not running these tests offhand.
Yeah, absolutely. I think that we looked at that actually a few weeks ago, and we have at InsideTracker around 48 blood biomarkers that we are looking at. And in a routine test of a clinician is around 17. So you miss, I would say, around 30 blood biomarkers that are important for you. I'm not saying that you need to do them all the time, but I would say once a year or once a couple of years to do the 48 is like, I like the analogy of the car, so if it's okay with you, I will provide it.
I use that on almost every episode. Please use it. We love it here. Yes.
So every 5,000 miles, you take the car to the technician plug a computer, and the computer telling the technician what to do, and then the technician doing it, and then the car good for another 5,000 miles. When this routine maintenance was introduced in the 80s, the average lifespan of the car was around 100,000 miles. Now it's around 200,000 miles. So just routine maintenance allowed the car to, let's say, live twice longer. Now, if you look at us as a human, I'm seeing something like InsideTracker or doing the blood test is like the 5,000 mile test. You plug a needle into your vein, extract the liquid gold showing to you what is good, what is bad, and what should you do about it. And then you do it, and then you're good for another 5,000 miles and do it again and again and again. What I'm trying to add here, in the car you have the 5,000 miles, the 10,000, then a big one, 15,000, 30,000, 45,000. So in those one, do the ultimate with the 48 blood biomarkers. Between that, you can focus on specific issues. So, for example, we found an issue for you with lipids. So just test the lipid again between the big test, and then after that, do that. And then maybe we'll find that you have something with the sugar metabolism. So do only the sugar metabolism, and later on do the big one. Then suddenly we'll find that you have an issue with iron. So do the iron metabolism. So what I'm saying is you need to build a plan, a smart plan, that will allow you to monitor your body all over your lifespan. It's not like a silver bullet. It's not once in a lifetime. It's a process. It's a hard work. And the person that will work hard, they have a better chance to live better longer.
And I think I love your message in that so much, because most of us still labor under the belief that genetics are the reason why we're unhealthy. And I feel so hopeful that people can turn around so many chronic conditions. I feel that they are not only symptom reduction. I believe many of them are reversible. Can you speak into that a little bit?
Yeah. That's a huge point. And I interviewed Nir Barzilai. Nir Barzilai is a professor at Albert Einstein, leader in the aging research, and he studies long-lived humans. So he call it centenarian, people that cross the 100 years old. He has, I think, 750 of those. And we discuss what to make them different than us. And they really are lucky. They are the lucky one. It's a one in, 10,000 or 100,000 that have a very nice combination of genetics that allow them to live to 100. So he told me like 40% of them are smokers. Most of them are not exercisers. They are lucky, There are some people,
right.
you know the lucky one that went with you to the university, studied for 1 minute and got 100 in
exactly.
and
Yeah.
they're
That's
lucky.
luck. That's genetics. That's luck. Exactly.
But most of us, I would say 99.9% of the population, including me, by the way, we need to be hard worker. And hard work will allow you to get what those centenarians are doing. So basically, if you look now on genetics, genetic or high level cover maybe 20% of our life. So 80% of that is lifestyle, nutrition, exercise, and so on. So nobody can come to and say, I have a bad genetics, that's why I will die at 50. No, there are a lot of examples of people that their parents died from cardiovascular diseases. They are not smoker now. They are eating well and they are exercising well and they don't have overweight, and they can live to 80 or 90 and they can live in a good way. We have a department at InsideTracker that study genetics specifically, and they're trying to assign what is the percentage of the phenotype, basically what happened based on genetics. And in the best one, like ApoB, is around 15%. But some of them is even less, meaning the genetic is small. It is important, but it's small. And much more important, how do you play with the card that you got with the genetic?
Exactly.
When you go to the casino in Vegas, the genetic are the card, and how you play it is your lifestyle. So you have a lot to do.
Yeah. I told the story in the podcast before. My aunt got diagnosed with glioblastoma this year and hated that, hate it still. But the moment that she got diagnosed, I went to a nutrition specialist team that will literally target supplementation based on the exact mutation she has, based on everything. So I just feel like there's not the worst diagnosis you could ever receive in the world, in my opinion, is glioblastoma. Like stage 4 brain cancer, that's like the one you don't want to hear. But in my opinion, and I mean this so truly, I always believe you can take an inch, and there's, no matter what it is, there's something that lifestyle can help with in some capacity. So I just want people to hear this really hopeful message from you, Dr. Blander, which is that yes, genetics might make for those extreme people. Yes, there are those people who are going to be the 1 in 1,000. Yeah. They've got it lucky. But for the most of us, the vast majority of us, there's always something we can do, and it's so important.
And by the way, those lucky guys, if they think about the lady that smoked at the age of 105, and Neil told me a joke, and he asked her, why are you smoking? Your clinician haven't told you not to smoke? So she said, yeah, the 4 of them that told me not to smoke, they're already
died. Right, exactly. Exactly.
So think about this lady. If she wouldn't smoke and exercise and eat well, maybe she would live to 150.
Exactly. I think that's what's really important about this aspect of the conversation too, is that maybe some of us start off at 0 and you might have to put in, and there is unfairness in the world. Yeah. Like it's not like we don't all get the same slate. Some of us grow up in moldy households and then we have autoimmune stuff and we don't know where it's from. We have all these things that are stacked against us, and yes, you might have to work a little bit harder than someone else, but I am of the firmest belief, and as are you, that there's always something you can do to catch up and get yourself there.
And the best day to start it is today. So
exactly.
If you haven't done it, start it today.
That's exactly right. Tell us about the process of working with InsideTracker, which you are also a sponsor for the podcast this season and this episode especially. So people will have the opportunity to get access to InsideTracker right after this. Tell us, how do we go through that process when people want to start their InsideTracker journey?
Yeah, it's easy. You can go to InsideTracker.com and select the plan that you would like to use. And then if you are doing the blood test with us, we'll supply to you a lab slip that you can go to Quest Diagnostic. There are around 2,000 clinics around the US. If you don't like to go to a clinic because you're scared of catching a disease or something like that, we can send a phlebotomist to your home or office, and this person, the clinician, can take the blood at your home or office. If you already have data from your clinician or from life insurance or any other place, you can upload the result electronically via our website. On top of the blood, as I said before, we also have integration with DNA, so you can upload DNA data. If you have done 23andMe or Ancestry, you can upload it. If you haven't done it, you can do it with us. We have a DNA kit. You also can connect with a activity tracker. We have Oura Ring, Apple Watch, Garmin, and Fitbit that we connected with, and that will allow you to receive much more value. After you go tested, you will receive the value that I assume that we'll discuss in the next question also.
Absolutely. Yeah, 100%. So, and again, I just want to say, first of all, I did InsideTracker and got very valuable information, my first round of labs, and they came right to my house and it was the easiest thing that ever happened. It took 5 minutes. The phlebotomist was fantastic. The company we partner with for phlebotomy is incredible. So that is absolutely an option. And the labs came back quickly. And the fact that, again, I have my own labs, when people go to LabCorp or they go through their doctor's offices, oftentimes doctors won't release the labs to them. The fact that you are putting the patient in the power seat, I love so much. And then additionally, you have a team of incredible nutritionists, clinicians who help to interpret those labs and make those recommendations. So yes, I would love to hear about that.
Yeah. So when you receive the result, as Michelle said, you can see it on our website or on our mobile app, and you can see basically each test. And if you have a few historical tests, you can see the trend. You can also see, as we discussed before, whether you are normal or optimal. So we'll show you, are you yellow or green or red? Yellow mean normal but not optimal, green mean optimal, and red mean out of the normal. We are then allowing you to develop an action plan. Basically, what can you do with that? So we are looking holistically on all the 48 blood biomarkers, the data from your DNA, the data from your fitness tracker, and you can choose what is your focus. You can focus on longevity, you can focus on endurance, you can focus on sleep, you can focus on building muscle or losing fat or distress. So we have around 12 different focus areas that you can select. Based on that, we will provide you a recommendation of 5 to 15 different interventions that including some food, supplement, exercise, and lifestyle changes. And then you can follow it, you can check in. We will send you a pro tips once a day about some important information that's important for you to know. Some of them are also based on physiology. So, for example, if your resting heart rate or VO2 max or your sleep is not optimal, we'll provide you some recommendation about that, and that's changing daily. We also will provide to you post-exercise pro tips. So let's assume that you finish your exercise. We'll tell you exactly when to eat, what to eat, and how much to eat or drink in order to replenish to your next activity or to optimize your body. So we are providing a lot of value to the user to allow him to optimize and live better longer.
Absolutely. And again, with my clients, I'm usually really a strong advocate for my clients too, whether it comes to their doctor's offices. When people are feeling ill or they are already feeling off, it's really hard for people to push in those doctor's appointments to get these labs. The fact that you have spent so many years researching what labs are helpful to people and making it so seamless, I just want you to know is so important to people. So for people listening, they're like, I don't even know where to start. I can't make my doctor run these labs. I don't know what labs to even get. I learned from all these different people, these labs. I think the ease of it is one of the most important components, honestly. And you've worked really hard to make it easy for people. So I commend you for that as well.
Yeah, I agree. It's not easy. And the operational process, it's not easy either.
No.
And so absolutely, it's we are trying to make, because if you think about it, there are a few barriers. One is the cost, and the other is also getting tested. And then when you're getting tested, then you have the barrier, I did all of that. I spent so much time, and then I don't know about X, Y, and Z. So having all of that and having the peace of mind that you have the information and a company that interpreted hundreds of thousands of users doing it, it's ease of mind for sure.
Absolutely. And again, thank you for that, because I have this saying in health, if it's like, if I don't do something, who else is going to do it? If you didn't do it, who knows who else is going to do it? So thank you for just doing it, I guess is the way I would say it. Is there anything else you kind of want to impart people with around longevity? Oh, actually, I have one more question before I ask that question.
Okay.
So my dear friend is also a pioneer of longevity, Dr. Gabrielle Lyon, and she always says muscle is the organ of longevity. I know you mentioned grip strength before. Have you been doing research into muscle and how important that is as well? Is that something that's been coming up in your research?
Yeah, absolutely. I know Gabrielle, and I
She's a
admire
huge
her.
InsideTracker. You guys do a lot of work together
Yeah.
too. Yeah, she's my
Yeah.
best friend.
And muscle is a very, very important for longevity for sure. So if you'll ask me what are the two most important recommendations that I can take generally to the general population is basically to lift muscle and improve their endurance. And for the example of the endurance, we just added the VO2 max, which is a marker of your endurance capacity. And it's something that's very important for users to test it. Even Apple Watch providing you this VO2 max, so you can look at it there and try to push it and improve it, because if you have a better endurance capacity, it will be easier for you to walk, to breathe, and to function at the age of 80, 90, and 100. And building the muscle, like lifting weight and doing all the exercise, will allow you to preserve yourself as a one piece, especially at the old age. The most prevalence cause of death is a fall. You fall, you break your hip, and then on average 7 months later you die. That's the grim statistic. But actually what happened is most of the people that fall and break their hip, they don't have enough muscle to protect the hip. Also, they're not in balance, so that's why you fall. So if you work on balance and building the muscle, you have a less chance to fall. Then even if you fall and you break your hip, if you have enough muscle, you have a better and enough strength, you have a better chance to recover from that. So definitely muscle is important for our longevity, and I couldn't agree with her more.
Absolutely. And I've worked in nursing homes for years, and you would see is people, and I know Gabrielle talks about this too, but I would see patients falling, and then it almost seemed like out of nowhere, all these other things would start going on with their health. And it's really also because muscle is an endocrine organ. So it's also interacting with the rest of your body in this way. So when it comes to longevity, we couldn't not bring up muscle as a huge component of that as well as being really, really important. Yeah. So thank you so much. That was a good last tip anyway. So thank you so much, Dr. Blander, for being here today. And honestly, just thank you for InsideTracker. Like honestly, and I really can't recommend enough to people listening. If you are looking for labs, if you don't want to go through the fight of going through a doctor's office and you want the support of people who actually know how to interpret these labs really well and give you really strategic recommendations based on them, I could not recommend you more. And thank you so much for being here.
Thank you so much. It was a pleasure.
Absolutely.